And a very good morning to you and welcome to K24 this morning. My name is Jeff Mote. As always, we love it when you're part of the conversation every single time. Right off the bat, you can get me at I am Jeff Mote or at K24 TV. Today's show is a bit different. We're starting off not the regular politics, but looking at government and service delivery. Now, coming off unprecedented pandemic year, what has changed on the government's priority list is a question we're going to be tackling right here. And with the new realities that the world is coming to terms with, what really is feasible in terms of what it can achieve? On the show today, we have Chief Administrative Secretary from the Ministry of Health, Dr. Mercy Mwangangi, and also Chief Administrative Secretary in the Ministry of ICT, Youth and Innovation, Nadia Ahmed, unpacking these issues and much more. So welcome aboard. This is K24 this morning. As always, I said, if you have any question, any comment as well, feel free to get me at I am Jeff Mote. On that, you can also get me at K24 TV. In studio, C.A.S. Nadia Ahmed. Morning. Karibu sana, welcome to the show.
Asante sana.
And I think it's good that I start, like, even before you went on air,
yeah.
the whole aura and vibe that you bring is very different from what you expect from the typical civil servant.
That's
by design, by default, how is it that way?
It's by design. What you see is what you get. And because I'm one of the youngest C.A.Ss in the team, it's very important for young people to see that even a young person can embrace a government space and still embrace who they are as an individual.
Right.
Yes.
And it's interesting because even as a young person, there's a way young people are accustomed to doing things. And we spoke about this just before you got on.
Yes, yes.
And there's a way government operates, not only Kenyan government, but
yes.
governments around the world.
Yes.
Synonymous with bureaucracy.
Yes.
How do you deal in that particular space? You're trying to be nimble, you're trying to move things forward, but you're told this is how government operates. How do you deal with those two worlds? I
think the secret is I learned that government is a facilitator. So once you have that in your mind, you understand that bureaucracy is put there for, there's a reason why it's put there. At times it protects you, at times it teaches you, but it also helps you keep in line. But at the same time, you have to understand if you have things you want to do, yes, there is the government embodiment, but at the same time you can partner with different people, whether private sector, development partners. So that's how I've learned my way around. On one side, I'm government official, but on the other side, I'm always open to collaborating and partnering.
Right.
Yes.
And let's talk about that learning and the learning curve.
Yes.
How was it for you, getting in a lot of, attention that came from, the Twitter streets, online?
Yeah.
Who's this 28-year-old getting into this particular office? How was it in terms of learning and, getting into that particular role in that space?
I'd like to say it was baptism by fire.
Oh, really?
Because on one side, you have been appointed, the president has called you, and now you have to get in line with what you have to do. Then you have just a short amount of time to learn your particular docket. On my side, as much as it was youth, so the past time I was working with the community, I was working with young people, so for me it became easier. Whatever I learned on community level, I now just had to put it into national level. And so there were tears, there was confusion, but I always say this, I have a fantastic cabinet secretary, Mr. Joe Mushe, because he made the transition very easy. The best advice he gave me is that be you as a young person. The president has appointed you guys to be young. So we're like, and I told you, we're like a prototype. If we mess up, we are spoiling the opportunity for the other young people. But so far, we're all doing well. And it's shown young people and also Kenyans that as young people, we can really take up the mantle and move forward. Yeah.
And it's interesting because even you talk about that, I want to just jump right before, the announcement of that particular appointment.
Yes.
Did you have any idea it was coming? Was any call made that, we're watching, we want to see how you're doing. We might give you a call pretty soon. Did you have an inkling that was happening?
No. In fact, this story, by the way, it trended so much, the Viazi girl, because I was literally, I'm a Mombasa girl. I was literally in town, in Old Town, and I was busy buying breakfast and going back to my colleagues to eat with them. Next thing you know, imagine you're hearing of an appointment on TV. And so
with everyone else
at
the same time.
Yeah, so the problem was nobody knew my real name. I go by a stage name, Nadia Nadi. That is my stage name until today. Then one of them called me and said, yeah, what's your name? And I told them, and that was it. And trust me, I don't know what happened, but I do remember I got into a tuk-tuk and went straight to, I went somewhere just to like, is that me? and my life just changed from there.
Okay, that's quite an interesting story, you know, from Nadia Nadi, the only CS I know who has a stage name. You can take that to the bank, of course, but you also have Dr. Mercy Mwangangi, who'll be coming on the show as well. When you talk about baptism by fire, clearly that was in her docket. As we talk about that, let's actually look at the front page of the dailies. Clearly, she was burning the midnight oil on this one as well. Season of Hope as vaccine lands. We were giving you live pictures even as it landed at JKIA yesterday and night into today morning as well. And clearly, she was front and center on that. We're glad she made time to be on the show as well. We'll be talking about this and looking at your newspapers later on at 1:30 as we get our political analysis for the day. But right now, let me welcome Dr. Mercy Mwangangi, C.A.S, Ministry of Health. Morning, Daktari.
Hi, how are you?
Sana. Welcome.
Pleasure to be here.
Asante Sana. Thanks for making time
so
as
much.
well. And, you know, I think probably 3-4 hours of sleep for you as far as this has been concerned. So again, many thanks for making time. And I want us to start from there because Nadia said for her, it was baptism by fire. Some things she wouldn't have thought of until she got into the role.
Yes.
When I come to your docket,
yes.
I mean, totally different kettle of fish because what you're experiencing was something totally unique globally.
That's
How
true.
do you transition into that particular role with no blueprint? You can't look at what the UK did. You're learning on the job with the rest of the world.
I mean, it's been, should I say, an experience that builds you as a person. We say we've been chewing gum and walking at the same time and thinking. And that's the best expression of it. So you jump in there, it's a pandemic, it's a global crisis. You're trying to put in place interventions that protect Kenyans. Let me just say it was a very, very interesting, fun roller coaster ride.
Right.
But we had a good team, and we have a good team. Let me begin by perhaps even appreciating the president's role that he played in the COVID-19 pandemic. Very early on, I think around March, there was an executive order that actually put together a team, and a team that approached COVID using a multi-sectoral approach. And often you'll hear, you know, government use those words, whole of government approach, multi-sectoral approach. But it really matters because for the first time ever, we had the Cabinet Secretary of Health sitting there, chairing this committee, sitting with the Cabinet Secretary in Foreign Affairs, Transport, ICT, all putting our minds together to try and put in place a response for Kenya. And really through that approach, which was envisioned by His Excellency, the President, we were able to get to where we are today. Okay. And, you know, pretty excited because I'm seeing all the headlines today are saying it's a season of hope. Yes, we got our 1.025 million doses yesterday. So very excited. And perhaps I like what C.A.S said best, that we've been fighting with rubber bullets, now we have machine guns, now that we have the vaccine here. And I mean, finally, a silver lining under that grey COVID cloud. We'll be talking about that also in specifics in just a bit. But just to wrap up this C.A.S conversation, because even in terms of perception, there's a lot of questions. Is this a political token that I need to give someone because of a political deal as well? How does that come across when you're working with people and saying the only reason this post is there is because they needed to reward some people, yet you're busy at the helm trying to deliver service to the citizens? How does that work? I mean, and that's you know, an interesting, should I say, component that I've had Kenyans discussing. And you know, when we got into these positions, I think we appreciated the work that the cabinet secretaries have. In any single one day, my cabinet secretary, Mutai Kagwe, has close to at least 15 invitations for participation in events, for engagement in meetings, for discussions with partners, discussions with bilateral organizations in any one day. So just today, I can tell you I have close to about 5-7 meetings that I have to sit on his behalf. So you can imagine the work that the cabinet secretaries have, and that's why the president put in place this position, to be able to lessen that load, but most importantly for us young CASs to really, you know, be those mentors for the youth, to have those platforms to be able to work, to learn, and to mentor others. And really with C.A.S Nadia, that's what we've been doing. We've had lots of engagements under Kenyan Imimi, mentoring young people, inspiring young people. Every new day I have a DM from someone young who I'm talking to and inspiring in their path.
And let me come to you, C.A.S Nadia, on this as well, because some people are saying, even in this particular position, is it one of those where you're in the room to be seen and not heard? So that publicly they know we have these people, but in terms of effecting policy change, driving it in a certain direction, you're told not right now, later.
Yeah, I mean, and I've heard this famous line, they are just flower girls. And I think I beg to differ with that, because if you see, yes, on one side we deputize our cabinet secretary, but on the other side, as young people, the president has put us there for a reason, and that is to really demystify this ideology that young people cannot work, they're lazy, and we like to just scream out. And so we also have our personal mandate as C.A.S. And by the way, most of the time people don't understand what Chief Administrative Secretary is. So Chief Administrative Secretary is equal to a deputy minister or an assistant minister back in the days. And so basically what we do, we have to deputize the cabinet secretary. We advise them on the different policies that are there. We go and really look at the structure on how things are doing. And most of all, we help not only the cabinet secretary, but also the president to understand the young people. So for C.A.S. Mwangangi, it's through health. Myself, it's through youth affairs and how we can drive the youth agenda. So no, we do not just sit there and just look the way we look, which again, I want to compliment ourselves. We look good.
You do.
You know, but we also have brains, and also we have others who also do the same thing. And so, yeah. Okay,
fantastic. So I want us to dig a bit deeper into your respective dockets. Let me start with the doctor of the moment, Dr. Mwangangi, of course. COVAX facility, finally, delivering on the promise. We have this in the country. And of course, there's a lot of, trepidation on this. What happens next? We saw the first time when you got masks, a total debacle there. And some people are wondering, how do we uphold integrity of this particular process as it goes to the Kitengela cold storage and from there? Because even yesterday, we had some lady talking about how she prayed and got a tender from KEMSA. I'm sure you've seen that story.
No, I haven't.
Okay, well, it was grilling before the parliamentary committee, and she said she prayed to God and walked into the KEMSA offices and walked out with a 40 million shilling tender. And some people are saying, we haven't yet dealt with that ghost. Here we are with the COVID vaccines. Are we having a COVID billionaires coming from this particular situation? How are we upholding the integrity of this vaccine rollout?
I mean, and that's a relevant concern. But let me start by saying that Kenya has been rolling out immunization, vaccination programs for a long time. In fact, if you go to some of the schools abroad in their master's programs, they will teach you vaccine programs and use Kenya as a case study. So that's how good we are. And there's a lot of infrastructure that has already been laid down in terms of our management of vaccines, particularly storage. Yesterday, you saw us receiving, the big containers of vaccines that are refrigerated. Those were quickly moved to Kitengela. And from Kitengela, there's a very special, intricate infrastructure in terms of bringing in the vaccines, barcoding them, and ensuring that we're able to trace them to the last mile. And one of the things that we'll be rolling out, and we will be inviting you to come with us and share this with Kenyans, is we want to take you through the IT system that we've developed for the vaccination program. We're calling it M-Chanjo, and the idea is that we'll be able to trace that one dose of vaccine all the way to a Kenyan in Turkana, a Kenyan in Marsabit who is receiving the vaccine. And so we put in place measures to protect those doses. And I think it's very important. We've learned lessons. We're very clear right now on what needs to be in place, particularly in terms of accountability frameworks. We are working with partners. I think you saw yesterday we have UNICEF, WHO working hand in hand with us. So there are mechanisms to ensure that these doses are safe and protected, but most importantly that the doses reach the right groups. And I'm seeing a headline here where it says politicians are jumping the queue. I'm not sure, how people, came to that conclusion, because there's a clear prioritization, matrix. Remember, we've only just gotten 1 million doses. Remember, we need to protect those people who are highest at risk. So the healthcare worker who has been working for 1 whole year in a pandemic, fighting, for your life, fighting for their lives, those are the people we need to focus on. Our teachers, immigration department.
Before I jump to C.A.S. Nadia, one more thing, because even as you roll it out, it has been said that it is voluntary. People aren't being forced to go and get this particular jab. How are you dealing with vaccination hesitancy? Because this is a conversation I had even coming up the lift. And some people are like, okay, fine, even if I can get it, are you going to go and get it? And you can get the sense of hesitancy in people getting this vaccination.
Well, here's the thing. It's COVID-19. It's a new disease, and it's expected, that the public would be wary. Remember, even as medical professionals, we've been dealing with this just for 1 year now, 1 year and a few months, in terms of trying to understand the disease. So it is new. But one comfort we need to give to Kenyans, and that is one of the reasons why we are here today, is that this vaccine has been able to undergo all the safety trials it requires to, to have gone through. And last week, I think I heard people discussing, oh no, it usually takes 10 years. for a vaccine to come out. How come this happened in, 1 year? And there's a really good sort of representation on Twitter in terms of what the steps were to be able to actually accelerate beyond 10 years, move it down to 1 year. And part of this includes investments. If we all remember America, the UK, many governments actually pumped a lot of research and development money into coming out with this vaccine. Kenya itself, as you're all aware, was one of the countries where we were doing safety trials in Kilifi. We had 400 Kenyans enrolled, and they all came out at the other end safe, sound, with no issues. So the vaccine is safe.
Okay.
Yeah.
Cass, Nadia, I'll come to you because where you stand, there's a very sexy term that's used in terms of youth empowerment.
Yeah.
Globally is used.
Yes.
What does an empowered youth look like from where you stand?
Okay, an empowered youth looks very informed, looks very represented, and looks like someone who is ready to get influenced by the way they think and by the way they receive information from other people.
Right.
That's the basic.
Right.
Yes.
Okay, and I like that how it's been encapsulated in there, because when you talk about that and the opportunities that come to this empowered youth,
Yes.
therein lies a bit of issues, because
Yes.
we make the bulk of the population in terms of that particular demographic in the country,
Definitely.
but largely feel sidelined in terms of mainstreaming their voice and how the issues can be put on the table.
Yes.
How do you change that narrative?
So you see, the narrative can only be changed if the youths are ready to change themselves. Okay, before being a C.A.S, of course, I had told you, I was working in the community with the youths. And one thing that I've realized that we do, personally, even I've experienced that, is that we would complain even before trying to understand and get information. And so most of the time you'll see young people saying, oh, we're being mainstreamed, oh, we're being marginalized, oh, we're being this. I mean, I'm an example, I'm a Swahili. So we are a marginalized community. But how did a Swahili girl get to where she is? It just didn't start by one day waking up and saying, ta-da, I'm here.
Right.
It started by me working hard, by me going to look for information. You know, the power of education and reading, you know, literacy is very important. The power of also not being scared of standing up and talking in front of people. And so these are the things that we are trying to really do right now. Like for our ministry, we have places where young people can voice out and be included. One of it is National Youth Council, because that's the Sauti ya Vijana's aspect. Then we have these small groups called Vikaos, where we go to informal settlements and we go talk to young people. So we usually go with partners. We sit down with them, we listen to what young people are saying, and then we try and use that to develop a strategic campaign or communication strategy where young people can understand.
Okay.
So I think the basis is young people need to start slowing down and listening before we can retaliate or act.
Okay, you mentioned the National Youth Council. I want to talk about the council as well.
Yes.
Do you feel it delivered on its mandate? Because now they talk with the Building Bridges Initiative bill, we want a youth commission. So did the Youth Council not have allowed enough voice that now we need to have a commission to deliver on this promise?
No, of course it did. It did do its work and it did go up as part of its mandate. But you see, you cannot compare a national council to a commission. A commission is something bigger. I mean, imagine having a youth commission who is managing all the young people in the country. I think that is a phenomenal strategy because it also gives us a chance as young people to see ourselves as important people and not only people who sit on the table, but also who enjoy the piece of chicken and the piece of beef that is there.
Right.
Yeah.
Okay, like that allegory that has been used on that. Let me come to Dr. Mwangangi on this as well, because when you talk about commissions, there's also the mooting of a health commission in your docket that's supposed to deal with the plight of health workers.
Right.
But where do we go wrong with this, Dr. Because even as we got the return to work formula for doctors and a court order for the clinical officers and nurses to go back to work, it seems to be the same problems year in, year out.
Right.
We have CBAs that haven't been, honored for very many years. And that seems to be the real sticky issue.
Right.
How do you deal with that once and for all?
I mean, one of the things, when you're having this discussion, we have to put it in the lens of devolution. About now close to 8 years ago, Kenya was devolved, we passed the constitution, and health, of course, was one of the big sectors that was highly devolved to the counties. And it's important for us to be pragmatic. When we look at devolution, we need to look at the advantages, what came out of devolution. And one of the things that I'm always excited about, and I always share it, is that for the first time ever, we had a near doubling of health facilities. So around 2012, we had close to about 5,000, 6,000 health facilities. We now have 12,000. So that's the power of devolution, because resources were closer to the people. We were able to invest in infrastructure, we were able to invest in workers, we were able to invest in equipment, and we had more hospitals. That means that the average Kenyan traveled fewer kilometers to get to a hospital. That means the average Kenyan, was able to access health services. When we look at and narrow down to human resources for health, again, there are good things that happen through devolution. For one, there was again an increase in the number of healthcare workers who are employed. We have more doctors, more nurses, more lab technicians, more pharmaceuticals employed by county governments. Now, there have been teething issues, and these teething issues have been occasioned by numerous factors, all the way from fiscal constraints, economic troubles that we may have, issues that deal with even, trying to have those processes streamlined at the county, harmonized. Remember, we had all healthcare workers employed in national government, so all those files had to be devolved down to all the 47 counties. It means setting up HR departments in the 47 counties. So there have been challenges, teething challenges, but we've engaged, highly engaged with the Council of Governors, and there is goodwill. It may appear most often than not, particularly in the media, that it may look like there's no goodwill to have these issues sorted, but there is goodwill. And perhaps one of the things that has happened of late is that we now have a cover. For the first time ever, healthcare workers have life insurance beyond the basic medical cover that is there. And that's through these discussions. That happened through the engagements with union bodies, engagements with medical associations, and engagement with Council of Governors. Right. What do we see going forward? How do we intend to deal with this? Yes, we've had, proponents of, put together a health service commission. We've been able to see, how commissions look like in the country, how they're governed, and how they're able to, effect their objective. And one of the things we're saying in the health sector is that, yes, while we're putting in place mechanisms to manage human resources for health, we have to remain cognizant of the fact that devolution has brought more gain than ill. And that we also have to be pragmatic. When you have a workforce who is present and is managed by two different spheres, it becomes difficult when it comes to managing productivity. And so what we're looking at is coming up with an organization, so some form of formation, whereby these issues will be discussed, where there'll be a coming together of membership from COG, from the Ministry of Health, from counties, from unions, so they can look at these issues and manage them. And already we are seeing good progress. For example, just yesterday, C.A.S. put out an advertisement to employ more doctors and healthcare workers. So these talks are actually now bearing fruit, and the future is much brighter. Okay,
let's talk about future with C.A.S. Nadia as well.
Yes.
And talk about a campaign you've been at the forefront of, Kenya ni Mimi.
Yes.
C.A.S. Mwangangi is also part of it, a friend of the campaign, so to speak. What really is it about, and what are we expecting at the end of that particular time?
So basically, Kenya ni Mimi is a campaign that we came up with, of course, through the mentorship of the Cabinet Secretary. And it's a vehicle that is helping young people understand government opportunities, understand private sector opportunities, but also it helps young people reinstill back the values. Through our research and development, we found out that a lot of young people don't really feel like they are Kenyans and don't really feel like they're part of Kenyans. And so that's the biggest problem, because if a young person, and we are 75.1%, if 75% of us don't feel like that, what happens when we come to vote next year? People won't be voting on basis of I'm a Kenyan and this is my responsibility. Rather, it will be on basis of, again, it's going to happen. And so what we want to do, we came up with Kenya ni Mimi, which means Kenya is me. Like, own Kenya as yourself. The responsibility to change is for you. The responsibility to know information about the government programs is for you. And the responsibility of conserving the environment is yours. And so it's a vehicle that is sustainable. And I say sustainable because we partner with different developing partners and private sector so that we can create a bridge between the misinformed and the informed, but also between those who are looking for a purpose and those who don't have, and also those who want to be employed and those who want to create enterprises. And so we started it in January. Slowly we go to events. I just write hashtag Kenya ni Mimi. Fortunately enough, it caught UNFPA's attention. They decided they were going to be part of us of the journey and help us launch it. And lucky enough, His Excellency the President launched it last year on the 7th. And now what we are doing, we are going through a regional dialogue. So basically, we've mapped out regions in the country, and we're going to each of these regions to talk to young people. So we usually, it's a structure of 2 days. One day, it's mandatory and standard. We bring in our officials, whether it's from the health department, youth department, agriculture, education. They come, they sit down. Now, there's the difference. They don't talk to the young people about the opportunities. We allow the young people to own Kenya ni Mimi by them expressing their interests and also expressing their worries on the different programs that are happening. What does it have in the future? Kenya ni Mimi has no deadline. It's something that we wanted to go. So whether or not I'll be in the youth space after 5 years, I will still champion it, and I will still have young people to also champion it, because it's a realization mechanism to understand that the moment we let go of our country, you know, whether it's in the health or in the ICT department, if we let go of our country, the generation behind us is going to suffer. Right. So it's up to you as an individual, even yourself, as long as you're below the age of 35.
Yes. Does it not look like it?
I'm gauging.
Okay,
But as long as you're in that age, we are now going to empower you. And that's the reason you asked, how does an empowered youth look like? An empowered youth looks like us. Right. In the technocrat level, but also an empowered youth looks like the one in the ward level who's handed over a form to apply for an affirmative fund that will help them fund their mama mboga or their jiko from time to time.
Okay.
Yes.
Fantastic stuff. We're coming to the tail end of this interview. We have 4 or so minutes to go. Dr. I want to come to you and talk about, very briefly, if you could just summarize the state of UHC and where it stands. I don't know how we'll do this with the time that we have, because the promise was by next year, 2022, yes?
Yes.
We have it rolled out.
Yes.
But between the pilot counties and now, lots has happened, fingers have been pointed, and that's when really the blame game happens. County governments point to national points to county, and the citizens get lost.
Well, here's the thing. Let's start by describing what UHC is and what the objective of UHC is. Universal health coverage is usually, you know, it's a premise, it's a nirvana that we are all working towards to. And the idea is that we want to ensure that universally, that means all of us, all 47 million of us, are able to access health care, and this care is able to be responsive to their needs. Simply, that's what UHC is. UHC is not necessarily getting a free insurance card. UHC is not walking into a hospital and getting free care. UHC is not getting free medicine. UHC is not getting free dialysis, and we've seen lots and lots of confusion in terms of what exactly is UHC. And I must say, you know, one of the things that I'm at awe of our president is that he sat back and he was able to put together this vision that we need to put investments in the health sector that aim to allow better, more, you know, scaled up access to health services for all Kenyans. And that was his vision, that was what he wanted to do. And he came back to us as technocrats and he said, so show me, how do we ensure that we are moving towards this journey progressively of UHC? And what we did is that in the first phase as a ministry, we put together a pilot exercise. We took 4 counties and we were able to sort of fashion how can this system be able to, you know, provide more access to health services. And we learned from the pilot, you know, project that took place in the 4 counties. And those lessons were then now translated into the current program that exists right now. One of the things that we've been celebrating, the silver lining of COVID-19, is that lots of the infrastructure and investments that we put in place in COVID-19, particularly lab services, are all going towards the UHC program. Remember, the MES project has done wonderful things in terms of accessing, people accessing specialized services, dialysis services, cancer services. Those are available. That is also UHC. And right now, today, we are now in what we'd call the phase 3 of UHC. And ideally is that His Excellency the President will be giving 1 million families NHIF cards, subsidizing 1 million poor Kenyan families with NHIF cards. That means by the end of this year, 4 million Kenyans will have access to benefits in NHIF. And the NHIF benefits are tremendous. You can get outpatient care, inpatient care, cancer care, kidney care. The whole package of NHIF services will be available for 4 million Kenyans. And that's the untold story that people haven't heard about, but it's happening. The resources are there. We've already registered close to 500,000 households. Okay,
fantastic stuff. We have a minute to go, so I'd like parting shots from each of you. 30 seconds would be amazing. Kasnadi, I'll start with you.
Well, my parting shot is to Kenyans, young Kenyans especially. It is your mandate and your responsibility to take care of this country and to be able to be part and parcel with the change that is coming, and also make sure you support the young CASs that are in the executive right now, because we are a representation of you. And remember, Kenya ni mimi na wewe.
Okay, fantastic stuff. C.A.S. Mwangangi, your part.
I love what Nadia has said. Kenya ni mimi na wewe. And if we use that to look at the vaccines, Kenya ni mimi na wewe. So let's not be hesitant when it comes to the vaccine. Engage us. We have all the information that you need for you to be able to safely make that choice to be able to take the vaccine. And then most importantly, Kenya ni mimi na wewe, we need to support the BBI process. There's very many good things in that BBI process, more resources at county levels. And beyond the Youth Commission, we also have a mental and health and happiness commission. Sure. And we all could use some joy and happiness.
Absolutely. A lot of that, by
Fantastic.
the way. And that's where we wind up this particular conversation. Thank you so much for making time this morning. Right. C.A.S. Mwangangi, thank you so much for your time this morning. C.A.S. Ahmed, thank you so much for making time to be on the show. And just for the record, yes, I am still in that youth bracket. Full disclosure. We take a short break. We're back on the other side as we talk matters politics. Don't go too far. This is K24 This Morning.